Joe, can you hear us?
Yeah.
All right.
Well, I'm using my phone too. How's that now?
Good. Oh,
I'm getting huge feedback.
it's because you have this speaker on your computer, which is hearing the sound from your phone.
Oh, no. Yep. I'm gonna better. I turned off the speaker.
Oh my God. So you can't hear us through the computer. You can only hear us through the phone. Try it, unmute the phone and just talk and hear through the phone and keep the computer on mute. He can't hear me. Sorry, everyone. We're having some technical difficulties.
How about now?
Oof.
Give us 1 minute. We're just going to be switching phones.
Thanks, Tom.
Okay, can you hear me now?
Yes, can you hear us?
Yeah,
All right.
I am.
Much better.
For whatever reason, my computer audio isn't working, and I don't know why. So, Tom, if you could resend to Kate Leonard the link as well. She's having a problem getting in any event. I'm ready to roll anytime you guys are.
All right. Why don't we get started then?
Sure. I told, I'm going to move around on the agenda right now. I was going to start out with the parking issues that we encountered this one. The parking issues that we encountered last weekend that we agreed to discuss briefly today at this COVID briefing. We have placed in effect down by reject fees some interim parking restrictions wanted to see if we could, you could exhibit this, little show and tell there.
Joe, can you move a little closer to the phone?
You're going in and out.
Yeah, sorry. I think Pat Face stole my phone, so. Not to reposition myself, sorry. No, this is fine, Pat. This is fine. Can you hear me now, please?
Yes.
Okay. So we put in place some interim parking restrictions down at, around Rejects Beach. And if Tom Shevlin, if you can hear me, if you could put those pictures, share those pictures for the council. If not, I'll just describe them. So this is the entrance to, that you're viewing right now, the entrance to Ledge Road as you take the left or the right off of Bellevue Avenue. We posted it as resident access only, do not enter. Tom, if you could show the bottom of Ledge Road as well. These cones that you're looking at are just south of the parking, the legal parking areas. That these cones, or these barrels rather, inhibit access to the southern portion of Ledge Road. Of course, emergency vehicles can access that area. They're easily movable, but they're posted with no parking signs, and violators will be towed signs. Further, okay, Tom, you can go back to the screen, please. We've had an uptick in police presence in that neighborhood generally. We increased the manpower on the street with regard to that area. We've also been writing tickets pretty aggressively in that area. I'll just tell you, I went down there today, and there was indeed a police presence on Ledge Road. Going forward, and I think it's perhaps at the next council meeting, I have this concept in mind that I'd like to discuss with the council, and that is parking zones in the city. And really, in the way I designed it was creating an A through D zone, in which in certain instances we could either give the discretion to the administration, or during this COVID time, look at these zones and uptick the penalty for parking violators. This particular zone, in no particular order, I labeled it the C zone, and I think we can nicely zone out the city based upon certain roadways that dissect the city. We are also looking at, of course, if you recall, we just discussed this Wednesday night. We are still looking at the no parking or standing zones, not only, and I think Justin suggested them at Rejects, but also at Easton's Beach. The turnaround area at Rejects is cordoned off, so no vehicles can go down there. And we'll continue to work on other suggestions in an attempt to alleviate the parking problems for the residents.
Joe, when you mention the zone parking and there would be different fines in different zones, do you mean like parking violation in certain areas of the city would potentially have a higher ticket cost?
Yes. Yes, and it could be, it's based upon, and I'm talking about a lack of uniformity perhaps during the pandemic, if we see certain pressures in certain areas with regard to illegal parking. That's all I'm talking about. So yeah, and the way I designed it very briefly was 4 different zones, which I think all have kind of common themes within their context.
And would Newport residents, they would be able to park in all the zones? It would just be... Yeah,
of course. It's for illegal parking. So, okay. If you recall at the last meeting, I said, and I don't, a $25 parking ticket or a $40 parking ticket, whatever it may be for that particular infraction, probably is meaningless to people because that's, that may be the price of an expensive parking lot. So people are going to take that hit. So if we're going to be really aggressive about this, let's make it, let's make the hit uncomfortable and meaningful in terms of enforcement. That's the only thing that I'm getting at that I wanted to get through to the council. So I'm open to questions on this if you wish to discuss any of this.
I'll jump in if I could. Where do I raise my hand?
Go ahead, Justin.
Joe, I'm more than willing to take under advisement your recommendations, but I just have to wonder, the parking situation that we've confronting this year isn't much different than we've seen in other years. So what you're really dealing with is not a pandemic related problem. It's a problem that we've had perennially. And maybe what you're suggesting is something we should implement, but I don't see the nexus between the pandemic and, illegal parking. It's just it's a scourge we've had to deal with, and we've dealt with it sometimes better than others.
Part of me agrees with you. Part of it disagrees. I think it's anecdotal. But I got a text message Saturday night about the downtown area from a local resident who said it's like the jazz festival and folk festival weekend. Again, I don't have any metric to either agree really or disagree with you, Justin, but we are getting slammed with a lot of people, and those people get here through cars. And so I guess I'm 50-50 on it. Maybe I'll tend toward your opinion a little bit more because I don't have any way of really measuring it right now.
I've always been an advocate for a bigger parking fine, so that's not my argument. It's just we should deal with the problem, but it isn't necessary. If COVID goes away, this problem may not go away. So we're really looking at a problem we need to fix
right
as a perennial problem. So I look forward to your recommendations.
Sure.
Kate, you're on mute.
Has most businesses and most of the beach areas, and I see a huge influx of vehicles, huge, and I see them parked illegally everywhere. I don't know if we want to say it's the Freedom Ride when the state opened up, but in any case, it's much worse than it's been in the past. And I think that and I'll say it again, I've said it several times, we are working on a traffic plan that I think is long overdue. I think we need to look at what Charleston has done or Williamsburg has done, and our initial foundation for Newport plan, and possibly the zones are the way to go, but our roadways can't take much more. And I think people this year are frustrated and they want relief.
I know that we have a member of the public who has had their hand up for a while. I will just say we're going to have time for questions at the end of the meeting. We'll let the city manager go through his agenda, and then we'll open it up for public comment or question. Anyone on the council have more questions or comments on the parking situation? All right, I think we can move on.
Yes, thank you. Of course, the topic for the weekend that I wanted to, but I think you probably know, council probably knows as much as I do right now. Trash. I think I had mentioned a while ago that trash is a problem, continues to be a problem. I do think our staff has done yeoman's work with regard to the problem. But you know, we've all seen the pictures, and every time I see a picture of an overflowing bin, I go into overdrive, as does the staff. They've been very responsive in that regard. We have some thoughts, and those thoughts are as follows. We are going to, you know, the big bellies have been jamming up with all these pizza boxes and other stuff. And what we have found in many instances is people don't want to open up the big bellies. They don't want to open up the totes. They want to just leave the stuff on top of it, because we have found some of the totes, for example, you know, half filled, but stuff all on top of it and around it. So we're going to deploy, of course, we're going to deploy more trash bins out in the busy areas, and we're going to also deploy those Victor Stanley, the old iron bins. In addition to that,
Ooh, can we mute this 829 number? Tom, I don't know who this 829 number is, but can we mute them?
uh,
829-7799. Can you hang up if you're not going to mute?
Thank you. We're going to cut holes in the top of some of the totes, and we're going to give people a very convenient way to deposit their trash instead of on top of it or around. Deposit the trash inside the bin. I'm also going to authorize it, and it's already been in place, but I've pushed it up a little bit. Some additional shifts on the weekends to try to attack this problem. I will say every time we're aware of it, we attack it. For example, the problem that was exhibited this weekend down at the Armory. Once we were aware of it, it was cleaned up within a couple of hours, or actually sooner than that. So I have a very good reactive staff on the weekends. But as soon as these bins are empty, they fill up. I'll just tell you, Sunday morning that we had a crew out there of 4 employees plus waste management. We emptied most of the commercial bins along the way. I phoned in a number of them. For example, I thought the Wellington string of bins needed emptying. They were going to empty them anyways. They were emptied, and so I made that phone call about, I want to say 10:30 or 11 o'clock. But I will tell you, Monday morning, I took a drive down the city through the commercial areas. I was actually very impressed with how clean it was, remarkably. And I went down along Wellington Avenue, and those bins were chock full again. So trash is an issue, and there's a huge uptick in trash, and we'll just continue to stay ahead of it. I know that there is a movement out there from some merchants to adopt a barrel. We have Adopt a Barrel program, and we would welcome that participation. We also had a request, I think, for some merchants that wish to use their own barrels. I don't necessarily have an objection. There's going to be an issue with uniformity, but if we can just get through this onslaught and keep ourselves clean, then I think we'll be well ahead of the game. Incidentally, we do have an ordinance that has a restriction on the times in which we allow residential solid waste to be picked up, and maybe that needs to be tweaked, maybe not, or maybe it'll just be an overreaction. But I will just tell you that the issue of trash is first and foremost on our minds, and we will continue to attack the problem. I'm open to any questions on it.
I'll just say I know that there are a number of businesses in the city that are looking to do the Adopt a Barrel program and that are happy to do that and get involved. So I think that will be helpful.
Yeah, the application is online, by the way, and you can access it through our website. And we're more than happy to deliver those barrels and work with the merchants on the issue. I know they're very concerned about it, and as we are. But I do think our staff has been very active, and I think they've done a great job. And we'll just continue to grind it out.
Angela, did you have a question?
Hi, this is Angela McCalla speaking. Joe, I want to say, like, so I applaud you and the city in regards to, you know, the expediency of trying to resolve these issues. But at the same time, I feel like, is there more of a need for a longer, like, more visionary plan in regards to the trash? Because it seems to be like a chronic issue that just keeps popping up. And I know that there's some barriers, but like I don't think I'm fully grasping what the problem is. Is it just the time scheduling? You know,
it's the amount. It's the amount of trash. It's the amount of people. It's the amount of it's attributable to a lot of people not eating in restaurants and eating takeout and things like that. Again, anecdotally, I'm down at the Wellington. I see some guy take out 2 big bags of trash out of his truck. I wish I was a little more reactionary and then dump it in the trash can. It's an uptick. It truly is an uptick in trash. It truly is, and it's a result of the circumstances that we face now. It's a lot of more people and it's a lot more trash. We just need to stay ahead of it. We need to put out more bins. We need to attack it more aggressively, and that's what it is. And people don't.
Joe,
And yes.
do we have a longer term plan for replacing the big bellies? I know that in the shorter term, you said you're going to put the totes out with the holes in them, but I mean, it's been an issue with the big bellies that people don't want to touch them well before this.
Well, let me just say one thing. They're old. The brains in them have been replaced. We do clean them. We do sanitize them. I think that some of them do look disgusting. All you need to throw is a couple of pizza slices and an ice cream cone in them and spill it all over the place. It looks disgusting. So do we have a long-term plan? Yes. Once I think the contract, once we go out for an RFP for the next waste contract, we will look at what is available on the market in terms of the next generation, if you will, of receptacles, and we will spec those next generation receptacles. I've already started looking at it. Bill Riccio has already started looking at it. I think he's on the phone somewhere here. And, you know, that's our long-term plan. Trash.
What's the timeline for the RFP?
Well, I think we have another year to go on the waste management contract. So it'll be about that time. We can look at it in the interim, but it'll be a cost. And I've already started looking at it. You know, I understand the issues with the big bellies. We've already started discussing it.
Yeah. Okay.
I need one to eat pizza boxes. I can tell you that.
Okay.
I don't mean that facetiously.
Kate, do you have a comment?
I do. One, I think that it's easily understandable because one, there is a lot more trash. We have a lot more takeout because residents have limited seating. We have more day trippers, I believe, because they got their freedom tickets somewhat. And a lot of them have a loss of income from COVID and their job. So they come to Newport, and a lot of them pack their own lunches because I see them do it. And they come with coolers, and they open the coolers at Brenton State Park, at Fort Adams, and Turo Park. I see them do it. And they don't want to put the trash back in the coolers. And so this is what's come out of it. And I think that the businesses are struggling and they're doing their best to comply. So I'm appreciative that they would want to adopt a barrel. But I think a whole lot of it, because I see it with my own eyes, are people who come in with coolers and they just don't want to have their trash taken home. And I talk to DEM officials a lot because of Breton State Park. And I can tell you they are totally overrun with trash. And they can't even keep up with the amounts of trash. And they even hired more people. So it's not just the city, but it's the state. It's part of the times.
It's a lot of trash. It's a lot of trash. So we'll look at. It's an important issue. It's an important issue to the residents, an important issue to the merchants, and we will continue to hype things up and be aggressive with it.
I will say, a lot of the businesses and people that are talking about doing the adopter barrels, they recognize it as wanting to just be part of the at least near-term solution, which I think is great. But I'm glad that we're also talking about the longer-term needs.
Sure. Come up with
Lynn?
come up with an alternative other than a pizza box, and one of you will be labeled a genius, because those things have been a menace.
No, we're gonna make you hand get them all.
And I like pizza too. Yeah.
Yeah, I want to say I'm happy to see the businesses getting involved. I mean, we have had this program where you adopt a barrel for a long time. I think since, well, certainly before I was on the council. So I'm just happy to see a lot more businesses participate. I think it's going to be very helpful. And I'll be really happy to see those big bellies with the handles go away someday. It'll be good.
Susan?
Yeah, just quickly, I want to chime in that I love the, I don't know if they're wrought iron, but you know, the look of wrought iron barrels. I think aesthetically, they're just much more inviting to receive trash. And I appreciate the direction that this whole discussion has taken us. And again, I want to thank Joe, because I know, you know, personally, I know that he was out there on Sunday morning early overseeing the cleanup, and it's a situation that got out of hand, and I think that we are climbing on top of it. So thank you, and I'll be glad to see the wrought irons out there.
Sure. They will be deployed.
Yeah. All right. Is there any other comments or questions on the trash issue? Okay. Joe, I think we can move on.
Well, it certainly wouldn't be a COVID briefing without talking about masks and the continual efforts of our volunteers downtown. I will tell you, I've had an offer from one organization to conduct a metric on it. I've got to understand what they sent me, and I will discuss it further with them. I will tell you that our program has not gone unnoticed, that I was asked to be on a telephone conference today with the governor's office as to what are you doing down in Newport with these mandatory mask requirements. And so I went through what we have, an executive order mandating the masks. We have signage. We have certainly the wonderful volunteers, and we have what I asked them for, digital signs as well. I asked them for what they could augment us with is, how about sending us a few thousand surgical masks, the ones that are, you know, the disposable ones that we have procured. They had given us 1,000 of them in July, but those went overnight. We were able to get another 2,000 of those masks, but those are almost gone. So it's, again, they promised to get us some of those, take care of us on that. So it's a continual grind with the volunteers. I spent some time at one of the tables with one of the volunteers, and I got to tell you, you got to have great patience when you have discussions with people about masks and asking them to wear masks. You got to have a lot of patience. And my hat is off to the patience of the volunteers and how hard they're working and how tactful they are. And I'll tell you, I just think whether this is a reason, or it's the sole reason, or a bit of the reason. People downtown in those areas seem to be upticking on their wearing a mask. You're always going to find people not wearing them, but I think we're getting good compliance. I did yell at one guy who had a Holy Cross T-shirt on, and he immediately put on his mask after I said, "Dr. Fauci would be ashamed of you." Of course, Fauci is a Holy Cross grad, from young kid. So he popped the mask on. We had a nice conversation. I guess we'll continue to grind that program out, and because it is a marathon, it's not a sprint.
Susan, did you have a comment?
Yeah, to add to that, and so I appreciate that Joe's been talking with Rico, and I have reached out when we were playing phone tag today, and I caught up with him just before this meeting started. But I'm wanting to ask about cloth masks. I understand that a quantity was donated to the state, and I would like to the program. I mean, the volunteers are still enjoying it, which is, I know I nearly lost it down on America's Cup 10 days ago now, and it's what Joe describes is it takes patience, but we've got volunteers who are patient. I do think that it's just a little more challenging on America's Cup and Thames. It's just the crowds there are, I don't know what to say. I know Lynn has been out at Cliff Walk. When I was there with you, Lynn, the people were really appreciative. It's like, "Oh, thank you. Yes, I need one." It was like, "Oh, of course." The other thing that I want to say is that, and so Lynn, please do check in. Bellevue is comparatively compliant and easy, right, Jamie? But I just wanted to say that Tom Shevlin sent out a really great press release last Friday, and I spoke with Tom today, and I'm encouraging him. I think this press release should go to Boston Globe, the New York Times, Hartford, New Haven. Why not put it out there far and wide so that people who are coming to the city know what we ask, what we require, and what we're doing for enforcement. Also, big out to Gary for providing the community policing officers who stayed with the volunteers for the entire shift. And the volunteers all reported that it was much more fun with them. So thank you for that.
I have found that the compliance is much better also on the Cliff Walk. I came across a couple of people who were very, resistant. One guy tried to show me one of those bogus "I don't have to wear a mask" cards, so it's hard to fight with people when they're not going to do it anyway, but they do get the jeers from the rest of the people in the crowd, which actually helps a lot from my point of view as a volunteer doing this. So
great.
So may I continue?
Go ahead, Joe.
The last item on the agenda that I have is the numbers. The number that we don't have any local numbers. It's disappointing when we have these sessions and there's no local update. A number of weeks ago now, the local updates were coming out on a Monday. They're still not out today. I didn't check 5 minutes before I came down here, but I checked, a half hour ago, and the local updates weren't on the website. We did have 119 people in Rhode Island tested positive. At least that's what was reported for yesterday's numbers. There's 68 patients in the hospital, which is, of course, an important metric, down from, I think, 70 or 71 the previous day. That's the number to keep an eye on. The 3-day rolling average, or 3-day average, I should say, was in the 90s in terms of patient tests. So there is a tick up on the test, and I am interested in when I get those local numbers, I'll provide them to you. You probably have seen the advanced edition, online edition of the of the Daily News about the 16 Navy Academy prep students that tested positive when they got here. I know nothing about that. It's what I read in the newspaper. 16 out of 273. So that was kind of a tad bit surprising, but since they traveled here, I guess it shouldn't be surprising. But that's all I have today. As I said, when I get those local numbers, I will get those to you immediately, and then we could, hopefully they'll be like last week, in which cases we're well under, the weekly cases were, 1 to 4, I would say. So that's what I have, and I thank you for your time.
Thank you.
Lynn, did you have another comment?
Yes, at the last council meeting, we discussed whether or not we should continue our meetings in the council chambers or go back to having them on Zoom. And I know we don't have a meeting next week, but will we have a COVID update meeting next week, Joe, do you think?
Sure, it's an off week?
Yeah.
Yeah.
Yeah, it's an off week, of course, sure.
So I would like some guidance as to how to go about this, because I know we can't vote at this COVID update, but perhaps at the next COVID update, if we turn it into a regular meeting, so that we can vote on whether or not to continue with Zoom, continue at the council chambers or return to Zoom. I mean, I feel that it's very difficult for people to understand what's happening at the meetings. Anyone who's not in the council chambers really cannot be heard. And the recordings that I listened to on the website, you couldn't hear Kate, you couldn't hear the callers at all. As I said before, I think the public is much more engaged this way. And if the numbers are holding steady or ticking up, I just don't see the point in going back to the council chambers. And, we are not communicating any better there than we are here. I mean, we basically go there and then we leave, so it's not helping in any regard. And I think that we might actually be putting some staff at risk as well, so including ourselves. So I would really like to have a vote on this at the next meeting. I think I need to have 3 of you sign for that to happen.
Well, and Lynn, I think that the way that I know at one point the city solicitor in the last meeting mentioned how it would need to be posted. And Chris, could you comment on that?
Yeah, I mean, you can do it at the next meeting. All it has to do is be an agenda item that clearly states what you're going to discuss. And since these have been workshops in the past, we would put in that you would be taking a vote on the issue, that a council vote on the issue was expected.
Okay, so
But we can take care of that.
Okay, so I don't have to have 3 council members have a special meeting to sign.
Well, you are. You're technically meeting as the council. You're just doing it in a workshop format.
Okay.
I mean, you're still subject to the Open Meetings Act because you guys are having discussions even right now. This is really a council meeting, but it's just a workshop format.
So we could just put it on the meeting for the COVID meeting for next week that we will possibly vote on this.
Yes.
Okay. And do we have to have a vote on this, or do we just need to, or is it, we have to have a consensus, so therefore we have to have a vote, right? Is that sort of how it works?
Yeah.
Okay.
Yes.
I think it's best to have a vote on it just to have it be clear.
Okay. And do I have to do it through a resolution so that we have a certain time frame, or is it
I would
leave it open?
I mean,
I think it should be a resolution, Lynn, personally, so that at least that way it can be posted ahead of time for people to see and understand as well.
Okay, I'll get that to Laura.
Susan, did you have a comment or a question?
Yes, I do. The other corollary to what Lynn brought up is the extension of the emergency, and whether we are, making the move to continue to do that. It certainly seems that if we want to continue with Zoom meetings and continue to give Joe the flexibility to, that he's been using, I think that's something that we want to seriously consider doing. And so that should probably also go on the,
Today is the expiration, right, Joe?
yeah.
That's correct.
Joe, do you want, I would like to hear your thoughts before we move on.
Well, the emergency powers are, I guess fungible in a sense. There have been weeks that have gone by. At the beginning, it was very important. I would suggest it was very important. There was kind of a middle ground here in which they weren't that important. But now it seems like we might be in a new kind of era in which, at least if I need to act, I can act quickly and overnight or within a couple of days. And even though, like the parking thing, I had designs on acting quickly on some of the parking issues, though I guess Justin is right in terms of a lot of these long-term, some of this stuff is long-term issues. My attitude has been and will continue to be, despite the council, if the council wish to have me continue with those powers, I defer to the council, and I have deferred to them for the most part when we were able to get things coordinated with regard to Zoom and the like. So that's if I'm making any sense at all, maybe I'm not. I think the better part of the process is to have it as a backup, with the pledge to you all that I defer to the council's processes. If I needed some emergent thing, I still would schedule an emergent meeting, I think, if it was dire with the proper posting. So those are my thoughts on it. Those are my thoughts.
Jamie, I raised my hand because I would just like to respond. Both Joe and Chris, I think the big difference is that with the declaration of emergency, Joe, you can issue an executive order. And if we don't have the declaration of emergency, then if we wanted to change something that required an ordinance, it would require 2 readings. Am I mistaken?
No, you're correct. You're correct.
That's what I would say in favor of extending the declaration. Thanks.
Kate, did you have something?
Yeah, for a while. I had talked to Joe about that too. And because of ordinance changes and the time that it would take to happen, I now think with the changing atmosphere and issues around us with COVID and a lot of unknowns, that it's important that we extend the executive powers, and when needed, we can make sure that they're used. So I think that's important, especially with large numbers of people. And if COVID numbers increase even more, I think that we need to do the right thing for this community in terms of health and safety.
Angela, did you want to add to it?
Yes, this is Angela McCalla again. I also think about the fact that as the city is moving for our Newport public schools to be beginning to reintegrate the schools opening, I think it just makes sense to continue on in case, in an event, again, of an emergency. That's just
I
my thought.
agree. Well, and kind of on the same tack, Joe, I did want to bring up the conversation around testing. But Lynn, if you had a comment about the state of emergency, I would have you go first before we move on. You are on mute.
It's not so much about the state of emergency. It's just going back to having the Zoom meetings at City Hall. I just want to say that I am 100% appreciative of all the work that has gone into trying to make this hybrid work. And I know that the IT people, and I know that Joe, everyone has worked very hard and trying to make everybody safe and trying to make it work. And I do appreciate that. So I just want to recognize them, and that my wanting to go back to Zoom, certainly is not because of that. It's just that I just feel that we need to, we need to be heard better. But I know they've done the best that they can.
Joe, I wanted to talk about testing. I've had a couple residents tell me that they have had a lot of issues the past few weeks with testing, where they've gotten tested and they were told they were supposed to get their test results back in a few days, and 9, 10, 11 days later, they still haven't been able to get them. I know that it's not something that's like directly involved with the city, but I do think it's something that we need to communicate with the governor's office about. I heard from a couple of people today about it, and I told them I'd bring it up this afternoon because it is concerning, especially if we're telling people that if they come to Newport, they can take a test as an alternative to getting quarantined, but they're not going to get the test results back while they're here.
Yeah, that's the longest lag that I heard. I'm surprised at that, and I can bring that up on the call with the governor's office tomorrow. That's terrible.
Yeah.
I know they were expecting a lag, and that there was a discussion with that office, with the governor's office in Rideau last week about lags because of a national lag, and an issue, and that the state was working on it and thought they had it under control. But I appreciate you bringing that example up. I'll raise that example on the calls tomorrow, and it's unfortunate. And maybe we can get. I think we're going to get the same explanation in that it's to a certain extent out of the control of Rideau, because it's subject to the labs. But they had indicated that they had a remedy for it. But so it'd be interesting just to see what their response is using this example.
Yeah. Kate, I see you, but Justin had his hand up first, so I'm going to go to Justin.
Thanks. I just want to reiterate, it was my suggestion last week that the city, put together a listing of places where people can get tested.
Right.
The Globe did an interesting story earlier this week or late last week, in which they had 3 reporters go out and try to get tested, and it showed the variability of what's available. One person was able to do it, I think, in a day and get the results very quickly. Others weren't so good, but as a public service, I think it would be good if we actually found out where people could get their tests and let them know what their choices were. It's always bothered me. There was very little capacity, here on Aquidneck Island, but there are 100,000 people closer to us than there are to Providence. So having to drive to Providence doesn't seem to make a lot of sense. But I'm not sure what we can do. But I would recommend that we try to put that list together.
Sure, it's on. We'll consolidate it. It is on the Rideau website, but we'll put it together for our own website and give it a prominent place.
Thank you, Joe. Kate?
I have found that if, for example, it's a lifespan patient and you want to be tested, if you call your doctor's office, that the doctor's office calls, and almost immediately you're scheduled for a test in the parking lot of the Board and Carry building. It's a 1-day notice. I think that one thing we should find out from Rido is that, is it a faster process if a patient's or a person's doctor calls, and what the procedure would be to get the test done? Because I think if you just get a person off the street thinking he or she's going to drive up and get a test, that could be the problem with why they're not scheduled soon. It's probably the procedure and the process. But I know that they do it even at the urgent care clinic in Middletown. That if you go there, they ask people, do you want a COVID test? We'll schedule one right away.
Yeah, the issues that I've heard have been less about the scheduling and more about not being able to get the results in a timely manner.
Right.
Angela, did you have something?
I have something to add, but I'll wait until after this this particular subject is done.
Unless there's anything else that another counselor had to add on it, I think that we were ready to move on. Yeah, go ahead, Angela.
Okay. I just had a couple of questions that, or maybe food for thought. I'm not sure if we necessarily have answers. But the first question is, I know that the governor has been talking a lot about the PPP loans, so allocating an additional $76 million for small businesses to provide aid. I'm wondering if anything, are we involved with that, or are there, stakeholders at this point, kind of championing like this type of initiative to try to get more monies into small business owners?
The answer is yes. I mean, the governor has promised to roll out funds from the CARE Act funding for local businesses. I'm not aware of the timeline. I also know that the lieutenant governor is advocating additional funds increase over and above what the governor has suggested will be rolled out to local businesses. And I in fact was on the phone call with Lieutenant Governor. I think Monday, might have been Friday, I'm losing track, but the aid to local businesses is a big issue for the governor's office, and it is a big issue for Lieutenant Governor's office. And those funds, at least the ones that the governor, the $50 million for direct grants to local businesses, and the $26 million, I think, which of grants, or I call it technical aid to businesses, that is something that should purportedly is forthcoming soon.
So do we have anybody in the city of Newport, like the Chamber of Commerce or?
Chamber of Commerce is advocating very aggressively for those funds. Yes, I had a conversation with the Chamber Executive Director on Monday about that, because I had a conversation with Lieutenant Governor. I wanted to understand the distinction between the two offices advocating for the different sums of money, and I'm supposed to sit down with the Chamber Director, I think Thursday, to go over the nuances of the programs.
Okay, thank you. My second question, today I was watching the governor again, and she was actually doing a live feed in which both governmental and private sectors of businesses were all meeting together in terms of talking about more of an employment initiative. And what I also learned is that currently 60% of people that are, in the unemployment sector, 60% of the unemployment sector are actually women. And so they seem to be thinking about doing like key drivers. I mean, there were some pretty like heavy hitters there that want to roll out this initiative too. And I wonder if you know, if we can be thinking about that, because I'm thinking about the residents here in Newport, there are opportunities to gain skills, trade, and more access to higher paying wages in that sense. So just some food for thought, and I'd really love to see us as a city really try to get into the forefront of this, to try to recoup as many resources to help you know, our residents who are currently going under financial difficulty and maybe can't find a job. This may be a way to help provide some alleviation too.
I think that's a great point, Angela. Joe, is there anyone from the city directly involved in those conversations, or that is able to
The
get that
conversation
information?
I'm sorry, but I don't necessarily understand the food for thought point on that. That there are unemployment opportunities. If someone could just explain it a little bit more, because I wasn't following it.
So there is an initiative, both from the governmental perspective as well as the private business sector, that are collaborating together to bring this initiative to bring more jobs, to get more people
Right.
back to work.
Right.
This is, I think one of the goals is, their first goal is to create, they're going to start off with 5,000 job opportunities that are going to be rolling out. And then the second thing that I found really important is that there's going to be educational and training opportunities for, in order to access higher paying jobs, get people back to work. And really, again, continue contributing to the economy. So there seemed to be this robust conversation that happened today. And it was like on this afternoon. And I think you can find it, honestly, like I was looking at Ryan Belmore, he had a watch party, it was live. So there's certainly a recorded session that's happening. And I think my thought is, I would really love to see this type of resource also being allocated to the city, to our residents.
Okay, I understand. Okay,
You know?
I understand. Yes, thank you.
And that's kind of what my question was, is, you know, we have this initiative that's happening at the state level. Do we have anyone in the city that's directly involved? And can we get someone that is? So like Angela's saying, we have that
Yep.
information ready to go to give out to our residents.
Yep, we will look at it. And I will have someone assigned to it as well.
Yeah, Jamie. Kidding.
Justin, it's your time. And Justin, if you are speaking, you're on mute, but you are up next.
I just want to jump in and say, I think what Angela is talking about is important, but we do have certain, you know, the city is responsible for certain things, and in a state of 1 million people, the General Assembly is responsible for others. So Marv Abney, Lauren Carson, Don Oyer, Lou DePalma, these are some of the people that we should be drawing into this and telling them what we want as outcomes, because they're the ones in Providence who are in a position to influence the decisions that are going to be made. Not to say that we shouldn't get involved, but those people are getting paid bigger bucks than we are, and we should be making more demands on them.
I don't disagree, but I just want to make sure that we're getting that information as quickly as possible, so that we can get it out to our residents as quickly as possible.
Sure.
All right. Is there anything else on the council? I'm going to open it up to public comment. If there's anyone from the public who has a question or a concern about the COVID-19 response. And if you're on the phone, you can press *9. And if you are in the Zoom, you can press the raise hand button. Okay, seems like we are all set. I guess we're all set, and we can see everyone next week.
you.
You.
Thank you very much, everyone.
Thank you.